The most common cause of neck pain and the second most common cause of back pain. It's from a structure that many of us don't think about, but is very important to understand, is a source of pain and discomfort for people all over the world. In the spine, cushioning each of the vertebrae is a disc. We have discs in our neck, in our thoracic spine, and in our lumbar spine. Accompanying each disc in the spine are two facet joints. Facet joints are behind the spinal cord in the neck, and they're behind the nerve roots in the low back. Facet joints are synovial joints, so they're a little bit different than the disc. The facet joints are a synovial joint, much like your shoulder is a synovial joint, or your hip, or your knee. The facet joint is supported by a capsule and other ligaments spanning between the bones in the spine. When a patient is involved in a car accident, for example, they usually sprain the ligaments in the back of their neck and the accompanying facet joint capsules, causing sometimes long-term pain and discomfort. When people are on a cell phone or looking down for long periods of time, the ligament capsules surrounding and supporting the facet joint become diseased, dysfunctional, and painful. So it is thought that the majority of neck pain is related to the facet joint and the surrounding ligaments. About a third of the patients suffering from chronic lower back pain have facet joint issues. We see it all the time on imaging. It's not something that I think a lot of us really think about or understand as a cause. What can be done if you have facet joint problems or ligament problems in the back of your neck and lower back? Well, first, exercise and muscle strengthening is a foundational thing. The more that we strengthen the muscles, the more we are also strengthening the bone and the ligaments. Nutrition is very important. Medication can be helpful, but it's not the most helpful thing, or it doesn't fix the problem necessarily, but anti-inflammatories are probably the most helpful medication. Sometimes patients will do short-term muscle relaxants because as those joints become dysfunctional, the muscles can spasm around them. The pain doctors will do radiofrequency ablation, which is a procedure which numbs the joint. It just burns the nerve that goes to the joint. It has its benefits because it can help with pain, but it also has its drawbacks because the same nerve that goes to the joint also goes to the surrounding muscle, and that muscle can suffer atrophy or can become smaller and weaker as a result of the radiofrequency ablation. Surgery for facet joint problems is not ideal. Usually, we are looking at doing more of a fusion surgery than a disc replacement, which we can do for a degenerated disc. Interestingly, if a patient has a degenerated disc and we're looking to do a disc replacement, it is contraindicated to do a disc replacement for a patient that also has a facet joint problem. So it's critically important that we keep our facet joints healthy. This is why I think we have to be mindful about our use of cell phones. As people have used cell phones for longer and longer periods of time, we are at risk of chronic ligament injury in the neck for which there are no great treatments available. And I think that that will create a population among us that has chronic neck pain. Be kind to your facet joints. Take good care of them. Do everything you can to strengthen the muscles, maintain a good posture, have a good nutrition, and recognize that pain in the back of the neck and in the lower back may very well be related to the facet joint.